We're taking you live now to the city of Moreton Bay in Queensland. The opposition is speaking.
To enable them to live better lives. So whilst we are focused on making sure that we address the crisis that has been caused by Labor, don't forget that right now today the Labor Party are making an announcement to fix a problem that they have caused during their time in government. So we will support them fixing the mess because we believe that Australians deserve to have the support, the primary care support underpinned by Medicare, that I think every Australian thinks is the thing that makes Australia's healthcare system the greatest in the world. But make no mistake, health is another casualty of Labor's cost of living crisis. And I think Maggie and Trevor will give you the statistics that demonstrate in the electorates that they wish to represent that is right across the country, health has been the victim of Labor's economic mismanagement. Maggie.
Thanks, Anne. As I door knock across Ryan, people are telling me that it's never been harder and more expensive to see a GP, and that's reflected in the figures. Bulk billed GP visits across Ryan are down 17.8% under Labor, and that's over 200,000 fewer GP visits in the last year. I welcome the announcement by the Coalition today, and it's the only way we're going to fix Labor's healthcare mess.
Hi everyone, I'm Trevor Evans, I'm the LNP's candidate for Brisbane, and I have to report it's a similar story in the electorate of Brisbane. Bulk billing rates have crashed under this government by over 15%, from about 71% to about 55%. And what that means is that 250,000 GP visits failed to be bulk billed that otherwise would have in the electorate of Brisbane over the last 12 months. I also wanted to pick up on something that Peter Dutton said around the record rate of business insolvencies that are occurring at the moment across Australia. January, the month just gone, was the very worst month on record for business insolvencies. And what we've seen over the last 12 months is over 27,000 businesses across Australia go to the wall. Lots of people will be thinking about hospitality and manufacturing when they think about those business closures. And it's worth remembering that 1 in 100 of those businesses was a general practice, a doctor's clinic. And we've got to turn that around, and I welcome the announcements made by Peter and Anne today.
Thanks very much, Trevor. I'm happy to take any questions. Sure, mate.
If you want to cut government spending, can you roll out cuts to health in other areas such as hospitals and NDIS to pay for
Well, I think you just need to have a look at our track record, and that is that we invested more into hospitals. We support legislation that the government's put forward in this term of Parliament, which provides an underpinning of support to the NDIS and funds into those two important areas. I just make this point. The Prime Minister obviously doesn't want to go to a budget. Now, I think the Prime Minister is running from a budget because he doesn't have a good story to tell. The cost of everything is up, and the fact is that the Prime Minister doesn't have a good story to tell the Australian public about what's happened over the last 3 years, let alone what's happening over the next 3 years, particularly if there is a minority government. And I just think this is a very important point. We should make sure that the Parliament sits so that we can pass the legislation to guarantee this funding. And that can happen unless the Prime Minister runs to an early election. If he's running to an early election to get away from delivering a budget, you know that he's hiding the numbers. You know that he has no good story to tell about the achievements of this government over the last 3 years, and you know that it's going to get worse in terms of the economic forecasts. So I think the onus is on the Prime Minister to make sure the Parliament sits as scheduled and we can legislate to provide a guarantee around this funding, which is important for general practice, and that is something we would support, and we're happy to sit down and help draft the legislation with the government, but it should be enshrined in legislation before the Parliament prorogues, and we're very happy to support that. But I suspect the Prime Minister doesn't want to go to a budget, and it's because this government has been a disaster for families in housing, in cost of living, in health and many other areas over the course of the last 3 years.
Just go back to that though, so are you able to rule out?
We're not cutting health. We've been very clear about that. I believe very strongly in general practice. I believe in providing support to the hospital system, a good balance between public and private, and making sure that we've got a healthy private health insurance model so that people aren't turning up to public hospitals and pushing out waiting lists, etc. So no, you'll hear the scare campaigns from Labor. Let them come and legislate it in the Parliament. If the Prime Minister's not running scared from a budget, then Parliament is scheduled to sit within a couple of weeks, and that's when this legislation can be presented and passed.
I just have one more. You described the coalition as strong and prudent economic managers. How do you plan to fix some of the structural pressures in the budget, such as the NDIS and NPA?
Well, again, we've supported the government in legislation to curb some of the growth, and we've supported the government's measures in relation to trying to identify waste and fraud within the NDIS. You use that example. That has trimmed some of the cost curve, and we want to make sure that the NDIS, for example, is a sustainable program that can provide support to people and make sure that it's not going to collapse, because it has 9% year-on-year growth. It's at about $48 billion this year, which means that it spends more than what we do in, say, PBS or MBS, and we need to make sure that we've got a sustainable system. And so we've supported the government in terms of some of those structural saves, as we did in relation to aged care. And we're prudent economic managers, and if we want to address the cost of living pressures, if we want to bring pressure off groceries instead of the upward pressure that the government's applied, then we need a change of government. The government's energy policy is driving up the cost of everything because we're paying 3 times the cost of electricity in our country compared to comparable markets in the United States and in Europe. And I want to make sure that we can get our country back on track, and that's exactly what this election will be about. All right, thank you very much.
Peter Dutton there announcing that they will match the Albanese government's Medicare announcement. Peter Dutton also saying that he wants to make sure that Parliament does sit so they can pass a legislation and guarantee the funding to provide that guarantee.